This lecture is based on directing award-winning customer service, and it was put together by someone named Ruth Burke, who actually trains professionals on how to perform customer service. Customer service is critical to any of your careers. Customer service can be, you can have customers within your organization, you can have customers outside of your organization. And the way you treat those customers will help you be successful or prevent you from being successful in your job or your career. So what is customer service? Customer service is helping people and treating people with respect. What are the results of good customer service? Stop and think about when you go to buy something at a store and you're treated well. What is your reaction to that in comparison if you go to buy something at a store and you're ignored? Stop and think about that for a few seconds. Most people respond to good customer service by returning to that organization or to that retail store. If you're happy with Amazon and the way they deliver your products, you tend to go back to Amazon. If you're happy with a car dealership, you tend to refer other people to the car dealership. So the same holds true in health education. If your clients or teammates are happy with the customer service you provide, they're more likely to work with you in a positive way. These are some examples of results of good customer service. One is patient satisfaction, and patient satisfaction can also be used for client satisfaction in the field of health education. So if you work in a doctor's office and you have good customer service, your patients are happy. If you work at the health department and the clients you serve are served well, then they are satisfied with the services. They're more likely to utilize your services. As a health educator, that's critical because you want people to utilize your services and programs. Staff is satisfied. If you have good customer service to other parts of your organization, staff is happier. If you provide good customer service to your clients, the staff tends to be happier. Your boss, your provider is more happy because in healthcare in particular, you need to make money. And if you do not have good customer service, people do not come back. And if people do not come back for your service, then your services are no longer needed. And in the end, good customer service does result in higher revenue. If you work at a hospital and the people at the hospital, your patients are happy, they tend to want to come back for other services. They refer people to your hospital. If you work in a doctor's office and the people are happy, the patients are happy, they refer other patients and the revenue goes up. If you work in a healthcare setting outside of a healthcare place, for example, in health education, you work at a nonprofit organization or you work in a school setting, if you are doing a good job of customer service, revenue increases because there's less time spent on complaints. And the less time I have to spend on complaints, the more time I can generate new programming, and new programming might mean grants and other revenue. So how do you get to good customer service? What I want you to do is to think of the practice, meaning a doctor's practice, or think of your role as a health educator as making a movie. And think about where you're going to work as an intern or in your career that you're actually making a movie. Your patients or your clients are the audience. The providers or your supervisors are the producers. Your staff, your colleagues, are the actors. And the office manager is the director. What type of movie do you want your movie to be? Do you want your movie at work to be a drama, a comedy, an action film, or a feel-good movie? Which of those really is the type of movie you want your work movie to be? Most people would pick a feel-good movie. Most people do not want drama or an action movie at work. Most people want the feel-good movie because that makes people feel good. What are some common problems that people have with customer service? In a doctor setting, it could be a messy office, one that's not clean, there's old magazines, and no one greets the patients properly. In a retail setting, a messy store, old products, or no one greeting you when you walk in the store could be a problem. In health education, having a messy office or not having the most recent products in health education available, or not being polite to people when they enter your business would all cause problems. Most places, I want to talk about greeting patients. Most places that have exemplary customer service greet everyone and speak to everyone. So, for example, one of the hospitals in the Baltimore metropolitan area, one of the directors, one of the CEOs that they had, required everyone to speak to everyone they saw. So if you saw someone walking down the hall, you were required to speak and say, "How are you today?" or "Hello, how's your day?" Where I worked, when I was a supervisor at CCBC, we all spoke to everyone. That was part of the requirement. If you saw a student in the hall, you said hello. If you saw someone you didn't know in the hall, you said hello. If someone looked lost, you asked if they needed help. Every time you saw someone, you spoke to them. And that is to help people feel comfortable and provide that level of customer service that people need. People need to be treated well. And so that's an example of greeting people. So what if you work someplace where there isn't good customer service? How would you help implement that change? You have to identify what needs to be changed. You have to say, okay, this is not working anymore. This is really bad. And I'll pick something very simple. When people walk in the health department, no one greets them. Okay, that's a problem. That needs to be changed. Set an implementation date. So 3 months from now, the first of the month, we're going to implement this new strategy where people speak to everyone. Have a staff meeting and training. Have the staff meeting. You need to explain to people why that's a problem. If people have been practicing a certain behavior for 10 years at a work site, they don't think it's a problem. So you have to basically teach them why it's a problem, when the problem's going to change, and then train them on how to do it better. If people are not speaking to each other, they may not have the skills to do that, and you may have to give them those skills. And then fourth, you have to follow through. So you say, here's the problem. People are not greeted when they come into the office. By this date, that will change. You have the meeting and the training explaining why it's important to change, and train them and give them skills to help them make the change. And then you have to follow through. You have to spell out exactly what you expect. You have to say, stop this behavior and start this behavior. So if you say people must be greeted when they walk into the health department or into your office, you have to be very specific about what that means. Do you mean the person looks up and goes, "Hey"? Or do you mean the person says, "Hi, how are you today"? You need to be very specific and give very specific examples about what that appropriate behavior is. If you're the director and things don't go well, you're going to get fired. And if you're an actor and you don't follow the rules, you can get fired. And so you need to understand that part of that acceptable behavior has to have consequences, that if people do not follow through on what's expected, then there are consequences. And usually there's disciplinary action procedures that go step by step. You also have to use good judgment. How would you want to be treated in this situation? If you go back to that, usually that helps you with the good judgment. Good training also helps with good judgment. If I give you good training on how to do customer service, then you're more likely to do customer service. If I just tell you I want you to be nice to people, that's way too vague. We're going to talk a little bit about Chick-fil-A because they're known for their exemplary service. So think about the times where you've eaten at Chick-fil-A. What do you think about the service at Chick-fil-A? Most people have never had a bad experience at Chick-fil-A. I've never heard anyone say that service was horrible. And so there's a reason for that. Think about the average age of the staff. When you go through that drive-thru at Chick-fil-A, how old is the person usually in there? They're not usually somebody who's 50, although there are some 50-year-olds who work at Chick-fil-A. Chick-fil-A hires a lot of very young employees who are just getting their first jobs or who are going to college and working their way through school. Think about how nice most of those people are to you at Chick-fil-A. And there's a reason for that, because they actually train their staff to be polite. In Chick-fil-A, you have to identify what excellence is. And this goes back to the prior slides where we talk about being very specific about what you expect. So in Chick-fil-A's training, they are very clear about what they think excellence is. They think that people should be greeted promptly, that timely return of phone calls. And in Chick-fil-A service, it wouldn't be phone calls, but timely response to orders. But in health education, it's going to be timely return of phone calls. Convenient hours. Chick-fil-A has convenient hours. Wherever it is that you're working, are the hours where you work convenient to the people who need the service? Is it orderly and clean? People like to go places that are orderly and clean. Is Chick-fil-A orderly and clean? Have you ever been to a Chick-fil-A that was dirty? Is your office where you are a health educator, is it orderly and clean? Because people like that feeling. Up-to-date magazines and good internal communication. One thing that would destroy customer service is if there's poor internal communication in your organization. It's very hard to provide good customer service if the communication inside your organization is poor. So in Chick-fil-A, Dan Cathy, who's the president and chief operating officer of Chick-fil-A, used to say that he lived by the idea behind the second mile service, which in the Bible states, if someone forces you to go 1 mile, go with him 2. And his idea of what good service was, or excellent service was, that his employees always went the second mile. So before you can do the second mile, Dan Cathy stated, you have to make sure the first mile is taken care of. So you can't go above and beyond if you haven't hit what standard is. What is the standard? So if the standard is that you come to work on time and you do your work and you don't play on the internet, to go the second mile is above that. But you cannot go the second mile until you get the first mile under your belt. And so in the Chick-fil-A business, they go beyond the second mile. They provide hostesses, carry trays. They provide hostesses. The hostesses carry the trays. They sometimes have people come around to the table and ask you how things are going. Some Chick-fil-A's have ground pepper. Somebody comes around and says, would you like ground pepper on your salad? So, and he even said someone has gone as far as to change a tire for someone. So I'm going to give you an example of second mile service of where I worked. Where I worked, everyone was required to speak to people, be polite, try to provide service. So I'm going to give you 2 examples. One is there was a woman in a wheelchair who needed to go to the bathroom and could not maneuver it herself. And one of my secretaries, actually 2 of my secretaries, went into the bathroom and helped her get on and off the toilet. Okay, that is way beyond normal expectations. Another example is I worked we ran training for Job Corps students who sometimes are very angry students, and we had a student fail a quiz or something like that, and she just told the teacher to go F herself and was cursing and stomping. She had to leave the room, and we called Job Corps. They were going to come pick her up, and she was a miserable person that day. And somebody in my office saw how miserable she was and said, "We have donuts down the office. Would you like a donut?" And the girl was really angry and said, "Arr, arr, arr, no, I don't want a donut." And my staff member went down and got her a donut anyway. And as soon as the girl took the first bite of the donut, her entire demeanor changed. Again, that's second mile service. Saying hi to her and asking her how she is was first mile. But going that extra mile and getting her a donut and changing her whole day, that was second mile service. So what is second mile service, where you're going to be your internship or your career? Treat your patients and clients with honor, dignity, and respect. It's critical that you treat people the way you would want to be treated. Honor is recognition. Dignity is being worthy. And respect is an act of giving particular attention. So you want to recognize people, make them feel like they have worth, and make sure you attend to them. This means you will greet people with a smile and by name. "Hello, John, how are you today?" "Nice to see you today, Mary." "Tanya, great to see you today." Those are examples. Make eye contact. In this culture, in our culture in the United States, eye contact is seen as respectful. Be more efficient and save time. Don't waste people's time by not being prepared. When you send a client or a patient to someone, make sure you give them the name of the person to whom they're going. So, for example, "Oh, I can't help you with that, but I'm going to transfer you to Mary Smith. She can give you exactly what you want, and here is her phone number." That is the second mile service. Regular service would be, "I'm sorry, you have the wrong department. I'll transfer you now." Very cut and dry. So these would be some examples. Try to anticipate the needs of your patients or your clients or your coworkers. What do you think that person's going to need in the next 5 minutes, and get it to them beforehand. An example in a doctor's office is you give someone a lot of paperwork and you see they're struggling, and you go out and you say, "Hey, let me help you fill this out. I'll ask you some questions, you give me the answers, and I'll help you fill it out." That is an example of anticipating the needs. Looking at someone at a meeting who doesn't have a pen and handing them a pen. Something that simple is customer service. These are other examples. Follow your warm-hearted impulses. You all have those impulses of what it means to be nice. When you have that feeling like, "I should do this," then you probably should do this. Let me get you a bag. Let me help you out with that form. Be nice to people. You should rate your patients, your coworkers, or your clients' moods. You can ask them for an 8 to a 10 or a 3 to a 5. If someone is a 3 and you can take them to a 5, that's great. If they're an 8 and you can take them to a 10, that's great. If you think about the 2 stories I told you earlier about my secretaries helping someone go to the bathroom, or my employee giving someone a donut who was having a very bad day, those people's moods change dramatically by the service they receive by my staff. If you think back to Chick-fil-A, their statement is, "My pleasure." It's my pleasure to help you today. I'm happy to help you. Using those caring, positive terms helps people feel comfortable with your service. And it's important that you really mean that it's your pleasure to help them. And comment cards are things where you give people cards to fill out evaluations on the type of service they receive. So, how attentive and courteous were we, how clean were we, and, suggestions. These are very small examples of how you could do some evaluation of your customer service policies. Patients or clients are the most important people. They are not an interruption to your work. They are your work. So when you're working at the health department of the Lung Association, the Cancer Society, and you can't get your work done because clients keep coming in, the clients are your work. They are why you're there. If there are no clients, you have no job. So you have to remember that the clients are your job. And your staff must all act like it. They have to act like when someone walks in the office, you can't roll your eyes and goes, "Yes, can I help you?" You have to sincerely want to help that person. These are more ideas. When the clients come in, they're actually helping you. We're not doing them a favor by serving them. They're doing a favor by allowing us to serve them. We just need to do our job, and our job is to help people. This is why people complain about service typically. People are rude or unfriendly. The person who greeted them was either rude or unfriendly or did not greet them at all. Like looking up from someone and going, "Yo," that would be rude. Patients don't like it when others can overhear private conversations, and that's true in any setting in health education. If you're having a conversation with someone about their health behaviors, they really do not want other people to hear that conversation. A promise was not kept. "I'll get back to you in 2 days," and a week later, no one has called that person back. That is a problem in customer service. The staff does not care or is not helpful. They ask a question and nobody can help that person. No one goes that extra mile. Everybody's just doing the job and nobody shows that extra care and diligence. No one listened to their questions or concerns. It's like before they even finish asking the question, someone's giving an answer. People need to stop and listen to questions and concerns. And they had to wait too long. In a doctor's office, it would be in the exam room, but having to wait too long at DMV, or having to wait too long to buy a shirt, or having to wait too long to have an Amazon delivery. Those are all the same complaint. Waiting too long means that you disrespect my time. So these are things that you have to do to make sure customer service happens. You start at the top. You have to make sure the boss has customer service. If the boss doesn't have customer service, whatever the boss does trickles down to the staff. And you have to lead by example. So the reason there's paper clips here is the one thing we always talk about is if someone drops paper clips, help them pick them up. That is a customer service, even though it's up to your colleague. If someone needs you to hold the door open, you hold the door open for that person. It's leading by example. If you have good customer service, it's very likely that it's contagious and other people are going to catch it, and more people will have good customer service. Sometimes you have to change people. Sometimes there's somebody toxic in the organization, and that toxic person has to go. And that doesn't normally happen quickly, but it does happen. And it might take a year or two to encourage that person. Usually you can encourage the person to leave before he or she gets fired. And again, sometimes you have to change the people. If there's 1 or 2 people in 10 who are just not going to do good customer service, then those people need to leave. Effective staff meetings, and this should make some more sense to you now at the end of the semester. You have to set specific time boundaries, have an agenda, and end with a summation. This is an example of customer service within your organization. If you respect people's time and have an agenda and end meetings with summation, it helps people understand that you respect who they are. And for example, I worked on a healthcare committee in Baltimore County, and it included hospitals. We started at 8 a.m. and we ended at 9 a.m. And one of the reasons that it was an effective meeting, we met once a month, the first Friday of every month, 8 to 9 a.m., excluding July and August. When we met the first Friday of every month and we started at 8 and we ended at 9, the healthcare providers from the hospitals and other healthcare settings were willing to come to the meeting. Healthcare is a very busy, high-stress workplace. People do not want to have, you say we're going to start a meeting at 8 and it starts at 8:15, and you say it's going to end at 9 and it ends at 10. People are extremely busy. So if you say you're going to start at 8, you start at 8. If you say you're going to end at 9, you end at 9. And this group was extremely effective because that was one of the major rules that were followed every month. Occasionally we had a lot to do and they would say next month we're going to meet until 10. But it wasn't something like you show up and the meeting just goes on and on. It was very respectful of everyone's time. There should be somebody to control the meeting's direction, someone to keep time to make sure the meeting flows like it's supposed to, and someone who's a note taker. When you think back to the meetings that you had in this class, did that happen? And if it does happen, it tends to have more positive results. It's better customer service to your peers when this happens. This is an example of an agenda and what it would look like. So another thing that happens with good customer service is people like to have positive statements given to them. So you might give words of affirmation. You might say, that was a great job, or I really appreciate how you did that. Sometimes people receive gifts, and in my division what we did is once a year we had a picnic. At the end of the fiscal year in June we would have a picnic, and I would give out gifts, and they were gifts from the dollar store. But people really looked forward to it because each gift was unique to that person, and they each got an award as well on award paper, and each award was unique to a person. And they were funny. They weren't meant to be serious. Oh, I'm going to spend $50 on a prize. They were dollar gifts. And for example, one year we had a really bad year. I mean, it was horrible. There were so many things that happened that were negative. People died in my division. Our dean died. It was horrible. And so that year when we had our meeting, I gave out floaties, the wings that people wear when they swim, when kids wear. And I said, just so you know, if we sink, you're to put the wings on and save yourself. Don't look back. And it was a joke. But everybody's kept those wings. Everybody kept their floaty devices. And my guess is they still have them. And it was fun. It was a fun thing to do. Physical touch is very questionable, but often in a setting where you're working with people, you can touch someone and you can often say, is this okay? Quality time, if you only have 5 minutes with a client or a colleague or a peer or a patient, you need to make sure that 5 minutes is totally your attention to them, that it's not divided in other ways, and that you actually serve people's needs. Those are ways to help people. These are examples. Great job. Gifts, I've given you examples. Touch would be handshake or touch on the back. Time, you might share a meal, you might eat lunch together. And service means you just serve people's needs. So you really need to look at your practice, your work site, and your behaviors. You have to decide what is it that you want to change or make better. And how are you going to implement those changes? You need a plan. You cannot just say, oh, I'm going to do this. How are you going to do it? When are you going to do it? Who needs to be involved? And how are you going to follow through? And are you ready to lead the way to customer service? If you project positive customer service, if you demonstrate good customer service, if you show that you go that extra mile, others will follow. So if we think back to the beginning, and this is a movie that you're making, lights, camera, action, as you go out into the health field, are you ready to direct that movie that causes people to feel good? This concludes the lecture on customer service. You need to think about ways that you could actually implement positive or good customer service in your internships and in your future careers.